My name is Lissa Mackel, and I'm here from Regions Hospital Rehab Institute to talk about a partnership program created between the rehab team and community paramedics. This program was created as a community partnership to create awareness and support for individuals with new medical diagnoses. This collaborative program was developed to connect individuals with a brain injury, a stroke, or a spinal cord injury with first responding teams that they may interact with in the future following their return back to their communities. The goal of this partnership is to increase the communication between families and first responders while increasing the community outreach between the two organizations. The implementation of this program is fairly simple. At the beginning, we initiated a partnership between St. Paul Police Department, St. Paul Fire Department, and the hospital program. We developed the program internally and within the hospital. We expand soon into other police departments, and the rehab team will be there to support the paramedics and the families as they begin their partnership. The Rehab Community Outreach Program has two phases, one within the Rehab Institute and one with the community first responders. The Rehab Institute will start with educating families on the program, connecting paramedics with the families, and ensuring that communication occurs between both groups. The first responders will be informed of a patient that is ready to meet with them and then bridge that gap between returning home with a diagnosis and their stay at the hospital. The key focus for the Rehab Institute is to educate families about the community outreach program, to reassure families that there are community resources available for both brain injury, spinal cord, and stroke injuries, and to initiate that initial contact with first responders. The key goals for the first responders are to create a partnership with survivors and families following a life-changing event, to bring awareness of services that are available in the community, and to create a comfort level for patients and families to utilize community resources if they have an additional medical event. The key focus for first responders is to understand that there can be cognitive changes that occur with both brain injury and stroke survivors, to be aware that there may be mental health changes with individuals that have a huge life-altering injury such as spinal cord injury, and understand that families and patients worry and wonder when it is time to call for help when they return home. What you need to know that this program is completely voluntary. This program will be offered to our patients, and if they choose to participate, we will then connect the paramedics at the hospital with the families. The goal is to create that connection and comfort level for individuals that may need to contact first responders when they return home. What this program does and what we want to do is to connect the dots from a critical medical event as part of their recovery process so that they can return home safely and feel comfortable with their new medical diagnosis. Thank you for listening to the Rehab Institute Community Outreach Program.